what's contraindicated in terms of yoga practice, I think the context is if you're working with someone with an eating disorder, but not for the eating disorder only, what kind of things can cause problems? So I thought that was a good question. Generally, you know, there's two levels of things. One would be anything that brings attention to the body in a non-purposeful way or intentional way. So people are having issues with their own bodies, and you're sort of bringing attention to the belly, bringing attention to areas that might be difficult for them, or be sites of past trauma. That's the main thing to be careful. A lot of it's easy to sort of forget yourself because you're doing yoga, and then, you know, give someone a correction where you're touching different parts of their body or having them bring attention to different parts of their body. So that's one thing to think about. The other larger thing I would say would be to think about moving prana too quickly. So prana can really move things around, not only in the pranic body, but in the Vijnanamaya kosha, where knots and trauma and past experiences are stored in the subconscious mind. So pranayama, any kind of strong pranayama, even not strong, you would think that like vata balancing pranayamas like ujjayi or alternate nostril breathing would be fine, but sometimes any pranayama at all can move stuff around. And, you know, that's not bad if you're in a context where you're set up to deal with that and help the person. But if you're in a sort of regular yoga situation, you don't want to trigger people in an unsafe way. So unless you have a real plan together, I would stick to not using pranayama. Probably the safest, you know, you can do meditation techniques. I would say that actually, like, sort of mindfulness meditation is less stirring for most people than strong pranayama techniques. So I would actually just skip that whole area. So those are the main contraindications. I mean, there's many in terms of other things. If you're working, you know, with a body that's been sort of ravaged, you know, by non-nutrition, so you're going to watch out for osteoporosis, bone issues, sort of malnourishment, low blood sugar. So somebody's not eating, they can pass out, especially if their head's down. So you have to sort of keep your eye on the person and just be very mindful. And you also want to know where they are, if they're in recovery, if they're sort of on the way up or the way down. And if they're on the way down, you want to be very, very, very careful. If they're in recovery, often they sort of will know their own limitations. You can be more in dialogue. But anyway, I just wanted to answer that question. And certainly, you know, most eating disorder treatment centers have yoga as a component. So it's very useful. But, you know, you don't want to force the emotional issues in someone's system until they're ready to handle them, or at least have support around them. So in that context, in a general yoga context, you want to be very careful, unless the person has had yoga experience and sort of understands what they're signing up for.